I was 100 pounds overweight, 110 pounds overweight at one point in my life. I lost weight a couple of times in my life, gained it and lost weight. At my heaviest weight, even minimal activity caused shortness of breath. At Beth Israel Deaconess Medical Center, I am the bariatric nurse coordinator. Being on your feet all day in clinic, my ankles would swell, my feet would ache, hypertension. I never thought I would get hypertension.
All right, I'm just going to listen to your chest.
Okay.
I explained the risk to her as you are in middle-aged years. You're now short of breath just climbing a flight of stairs. If you continue this way, you won't be able to walk when you're 65 or 70. You won't be able to even walk down the street. Patients have a hard time understanding risk. It's hard to understand the concept of risk because there's a chance that it may not happen to you.
Dr. Povian suggested a few options for me.
Try to keep the weight off.
There were
Lifestyle change.
medical
And if you
interventions,
take
some
medication
medications,
again, at least the appetite suppressant, you're going to feel full.
weight loss surgery.
We actually have to transect. We have to cut part of your stomach. I do not use a lot of hard numbers when I talk about risk with a patient because they can't see it in those terms. They don't care that 50% of the population is going to develop such and such, if they don't do something. They want to know what's in it for them, and I get very personal because not everyone really likes to talk statistics. I think if you're not an economist, you don't want to talk statistics. With the weight loss, to assess their personal risk, you need to know about family history. And if I get a history that the patient's mother had diabetes at age 50, then I know that that patient's risk, if they're overweight, is very high of them developing type 2 diabetes, and I will tell them that. I do like to use anecdotes. So an anecdote would be, in 5 years, I'm probably going to be putting you on at least 2 or 3 medications for your diabetes. You'll probably be on 2 medications for your blood pressure, and you might have had a heart attack by then, if you don't lose weight.
Dr. Povian communicated the risks of me not taking medication, of not having weight loss surgery, of keeping weight on very loudly to me. And she made it very clear that I needed to have results in the way that we chose, that we agreed upon together. She explained the risks to me professionally, but what Dr. Povian did was speak from her heart.
All right, so it's a lot to think about.
I decided to choose the natural route of exercising and seeing the dietitian on a monthly basis, agreeing on the lifestyle change being the most significant. I chose not to take medication because I know that when you take a medication, there's always side effects to medication. And I grew up in a family that chicken soup was the ultimate cure for everything. And I also decided to choose the natural route because every time I went outside of myself for the answer, it was never the answer. Dr. Povian, however, said to me emphatically that hypertension needed to be treated.
That is very important to get your blood pressure down.
I agreed. I made a decision with her that if I didn't lose weight or if I lost weight and my blood pressure didn't go down, I would take blood pressure medication.
All right, let's see.
I've been keeping the weight off successfully.
Excellent job.
I'm living in the house of my dreams. I'm living a very natural life, and the course that I'm going to take will still be facing many challenges. And no matter what stressors come my way, keeping a happy attitude and keeping focused on being healthy.